So let's talk about this promise about what President Trump said this bill would be. He seemed to have been very clear. To the Washington Post in January, he said, quote, "We are going to have insurance for everybody." And he told CBS the following during the campaign. Take a listen.
Universal health care.
I am going to take care of everybody. I don't care if it costs me votes or not.
Who pays for it?
The government's going to pay for it, but we're going to save so much money on the other side.
Now, Dr. Price, I know I don't need to tell you there's no study of this bill that suggests it will provide insurance for every American. In fact, the Nonpartisan Congressional Budget Office, and I know some have issues with it, but they say 24 million fewer Americans will have health insurance under the plan. Given that the fact that the president promised insurance for everyone, how do you justify to the millions of voters who believe President Trump that there would be insurance for everyone when there clearly is not going to be?
Well, the president is committed to that, as am I, and those of us at the Department of Health and Human Services. The fact of the matter is, this bill that's moving through Congress right now is simply the first step in this process. The 3 steps include not just this bill, but the administrative changes that we're able to put in place at the Department of Health and Human Services, all those regulations and rules that were put forward by the previous administration. Many harmed patients and drove up costs. We're going to look at every one of them and make certain that we have those in place that actually help patients and drive down costs, and if they hurt patients and drive up costs, we're going to do away with them. And then the third bucket, the third part of all of this, are the other pieces of legislation that are moving through Congress literally as we speak. So the plan in its entirety is the one that the president has assured the American people every single American will have access to affordable coverage that works for them, not for government. And that's what we have in mind.
Well, with all due respect, sir, there is a difference between access to insurance and insurance, and there will be, according to the CBO projection and others, millions of Americans who will not be able to afford insurance, who will not have it anymore. So when you talk about the goal being everyone having insurance, and President Trump was very clear that if they couldn't afford it, the government would pay for it, are you talking about after the 3 steps, or are you talking about even longer down the road?
Well, again, remember what the Congressional Budget Office looked at was simply this first piece of legislation, which is not the plan in its entirety. Imagine, if you will, a system that actually drives down costs of health coverage for individuals. That's the one that we envision. Imagine, if you will, a system that actually provides patients with an array of options, something that works for them. Not that the government dictates to them that they must purchase, but something that works for them so they can see the doctor that they want to see, they can see the health care provider that they want to see, they can go to the hospital that they want to go to. Those are the kinds of new things in a plan that we envision, and parts 1, 2, and 3 will accomplish all of that. That's what the president's talking about.
So just to put a button on this, you're saying that after the third part of this has passed and the president has signed it into law and time has gone on so that it's been implemented, every American will have insurance. There will be universal coverage.
Every American will have access to the kind of coverage that they want. Remember what the president talked about in his joint session? He said that we've got to make certain that those with pre-existing illness and injury are covered. We need to make certain that we provide the states the kind of flexibility that they need to fashion their Medicaid program for their vulnerable population in a way that actually works for patients, to make certain that we had tax credits for folks so that every single American has the financial feasibility to purchase coverage, to address the purchase across state lines, to make certain that we're driving down drug costs, to make certain that we address the lawsuit abuse that exists in our country in the area of health care that drives up the costs for so many individuals. So the plan in its entirety is one that we believe will be strong, will be efficient, will make it so that every single American has access to the kind of coverage that they want, not that the government forces them to buy.